Catheter-related bloodstream infections are one of the commonest nosocomial bloodstream infection which result in a lot of morbidity and mortality. And I think the most important thing to prevent CRBSI is the proper education of the nurses and the clinicians, the proper surveillance, and one has to properly do the hand hygiene, the cutaneous antisepsis, then sterile barrier precautions, proper observation, and all these factors can prevent the catheter-related bloodstream infection, or what we call the CRBSI. You know, Dr. Ramesh, I want to ask you, how quickly can you say, suppose I insert a catheter today, how quickly can you say that it is CRBSI?
It's a very good question, Dr. Chawla. It's a common question I think a lot of people think about. The first thing I would look at is if a patient develops a fever in the ICU, and the first thing I would do is a detailed examination of the patient from head to toe. It has to be completely uncovered, head to toe, a careful examination looking for every possible source of infection in the ICU. I would look for sites of any prosthetic devices, look for lung signs with increased secretions, changes in oxygen, if there's any surgical wounds, drains, abdomen, the catheter site obviously, and the duration of the catheter in place, and the risk factor of the patient. Look at all those things, and I need to be reasonably sure that I can't find any other source and the catheter seems to be a likely source. Then I worry about CRBSI as the likely source. If I have worsening secretions, new onset infiltrates, worsening hypoxemia, then more likely than not, then it's going to be a pneumonia than a CRBSI. So long answer short, detailed examination, rule out all other possible causes of fever, think of non-infective causes of fever. Then if you think there is no other explanation for fever except the catheter based on the circumstances, then I would worry about CRBSI as the first diagnosis.
How quickly can you say that?
It's very difficult to say it.
I mean, they say within 48 hours. If you don't have any other...
so from the time of line insertion?
From the time of line insertion.
Okay. So the puristic answer is, according to the CDC guideline, the duration is even if there is no minimum duration before you need to call it as a CRBSI. According to the CDC definition, even 1 day is adequately good. But probably what we have seen is somewhere around 5 days the chances of CRBSI starts going up, and around that time is where I would think of it. In a high risk patient like burns and patients who have other issues, maybe even 3 days is enough to cause a CRBSI. So in that context, but the puristic answer from CDC is no minimum duration is recommended, but very unlikely in day 1 or day 2.